From our 22 News Broadcast Center, this is 22 News in Focus.
I am Nick Oresco and welcome to 22 News in Focus. October is Breast Cancer Awareness Month, the annual campaign created back in 1985 to increase awareness of this disease. While both men and women can be diagnosed with the disease, according to the CDC, breast cancer is the second most common cancer among women in the United States. This week on 22 News in Focus, we're discussing prevention, diagnosis, and the latest treatment options available for breast cancer. Starting off today, I am joined by Dr. Ann Friedrich of Bay State Surgical Oncology and Breast Specialist. Ann, thank you for being on the program with us today.
Of course, thanks for having me.
So for the next few weeks, this topic is especially important, especially as mentioned for women. Start off with the basics here. What is breast cancer, and if you can give us some of the symptoms associated with the disease?
Sure. So cancer is an unusual growth of tissue that cannot be controlled. And when it originates in the breast, it usually comes from either the lobules of the breast, those are milk-making glands, or the ducts that bring the milk to the nipple. We cannot really differentiate the two types without a pathologist and a microscope, but they're very common. In fact, 1 in 8 women will be getting breast cancer in her lifetime. And the symptoms of breast cancer are usually not present. Unfortunately, most breast cancer nowadays is screen diagnosed. Every now and then, someone will develop symptoms. Those can be anything from a mass in the breast is the most classical one. There can be skin changes, there can be a new asymmetry. Sometimes there can be systemic symptoms as well when the disease has spread beyond the breast. So it's a wide variety of symptoms in the end. And anyone with a new finding of the breast should be thinking, could this be a cancer?
Right. What are some of the risk factors?
Family history is a big one. The more family members you have that have breast cancer, the higher your chances are to get it yourself. There are certain genetic mutations also, and they can put you at an extremely high risk for breast cancer. But most common risk factors are in fact being female and getting older, and there's not really a lot you can do about these.
Now, a recent report found that African American women have a 31% breast cancer mortality rate, the highest of any U.S. racial or ethnic group. Why is there such a poor outcome among that demographic?
So Black women have two things that puts them at extremely high risk. They tend to get breast cancer at a younger age before the usual screening recommendations become applicable to them. And they also develop a type of breast cancer more commonly than other women, which is a triple negative breast cancer, one of the most aggressive types of cancer.
We talked about women and especially how they can get the disease. Men can get it too. How common is it for men to get breast cancer?
It's very rare.
Okay.
It's probably about 1 in 1,000 men that will get it, but we do see it, and there are certain genetic mutations again that can affect men as well, which makes them more likely for them to develop the disease in their lifetime.
So bottom line, anybody can get breast cancer. What are the latest technologies in screening and diagnosis along with treatment as well?
So there are a lot of trends in breast cancer. Luckily, we've done a lot of research about the disease, and though we're able to nuance both the screening and the detection as well as the treatment. So no two people with breast cancer will be detected and treated alike, I'd say. It's very common for screening to first be done using mammography, but certain high-risk people might benefit from MRI screenings. Okay. That's a new development, and there's 3D mammography as well that can help make mammography even better. There's also ultrasound, which can additionally be helpful for people with dense breasts. And if you're in a high-risk group, you may want to consider using multiple of these screening tools, maybe alternating, maybe even as often as every 6 months. And you may need to start screening sooner. Then once it comes to the treatment, we've developed a lot more nuanced treatment options as well. Every cancer is a little bit different. We know that there are different receptors and different subtypes of cancer, and depending on which type of cancer you have, you may respond to one treatment better than the other. There are analyses of the tumor itself, which is called genomic testing, as opposed to genetic testing, which can tell you how big your benefit from chemotherapy is. So we don't have to give chemotherapy to a person who won't need it. And then surgically, there are a lot of new developments when it comes to how much surgery is necessary, especially when we think about do we check the lymph nodes in the axilla? A lot of people used to have a lot of lymph nodes removed. Nowadays, we were able to come away from that and figure out who needs a few lymph nodes removed versus some people who may not even have any lymph nodes removed if there's no suspicion of disease there.
If there is a suspicion and a lymph node, for example, on the left side tests positive, what is the likelihood of a lymph node on the left side testing positive?
You mean on the other side?
Other side, I'm sorry, yes.
It's rare for cancer to spread from one side to the other. Usually if it does spread, the sequence is it originates in the breast, then goes to the lymph nodes next. And then next locations are often outside of the general thoracic area. It can spread to the brain, the lungs, the bones. But there are some patients who have lymph node disease on the contralateral side. That does happen, but it's not very common.
So when someone does go for testing, what kind of questions should they ask their doctor? What information should they get?
So first of all, it's very important to review the pathology results with whoever you're seeing first. You want to know what type of cancer you have. Is it the kind that is fed by female hormones? Is it a kind that does not have any of these receptors? How big is it? Has it spread anywhere else? Is it in one part of the breast or multiple parts of the breast? And the other question is it something that you can feel in the breast, or is it something that is so small that it cannot be easily felt? Those are, I think, the most important first questions, and then based on these answers, you can come up with a good treatment plan.
You mentioned genetics. They obviously play a huge factor in all of this. The BRCA gene, what is it, and should women with a family history get tested?
So the BRCA gene is a tumor suppressor gene. That means essentially it's part of the genetic markup of our body, and the tumor suppressor genes help our body not develop cancer in the end. When there's a mutation there and they don't function as well, your risk for breast cancer is higher. There's actually not just the BRCA gene, there are a couple of other genes as well that we now know that we can test for. And there are people with a high family history that can test for it. Also, people with a new diagnosis of breast cancer might be eligible for testing if it meets certain criteria. And these criteria change quite frequently. Essentially, they expand almost every couple of months to incorporate more and more people. But there are definitely people that qualify with a family history, not just for breast cancer, but also other associated cancers, such as pancreatic cancer, prostate cancer might qualify for testing.
And to my knowledge, HER2 is another genetic gene?
Not a genetic team.
Okay.
It's one of those receptor types that are found on the tissue, and it can tell us if a patient qualifies for HER2 targeted therapy, which is usually something that's given with chemotherapy. And that's a way that has opened a lot of opportunities for patients with HER2 positive breast cancer, because oftentimes they're able to shrink that breast cancer quite significantly with this treatment, even before they have surgery.
Now, of course, even though it is rare for young women to get breast cancer, it is possible. We see it. At what age should women begin getting a mammogram? So
for average risk, we usually recommend starting at age 40. And then we suggest to do it every year. There are other screening guidelines out there that say every other year is fine, and that might be appropriate for some people. But on the other end of the spectrum, there are high-risk patients, patients with family history, especially with family history of having a mother or a grandmother that had breast cancer early. They might need to screen before the age of 40 or even before the age of 20. And patients with a genetic mutation, of course, also should enroll in high-risk screening early.
You mentioned the therapies, and obviously chemotherapy being one of them. I think if a younger woman is diagnosed with cancer, fertility is a major concern. Do you have any insight about what women should do, young women who haven't had children yet, diagnosed with cancer, and they want children?
Yeah.
Those steps?
There is, we often refer our patients in this situation early to a reproductive endocrinologist to talk about options. And oftentimes those options include some kind of cryopreservation of embryos or other techniques depending on where they are in planning. Sometimes there can be egg retrievals and eggs can be stored. And that is a really appropriate question to ask at the first initial meeting, because there's often a timely factor that plays a role. You do want to start treatment, but you also want to take that into consideration as well.
Right. With chemotherapy, though, you want to do the fertility treatments before that, correct?
Ideally, yes.
Okay.
However, there are some patients, unfortunately, that don't have time to wait for this. There are certain advanced types of cancer that should be treated sooner rather than later. So every now and then, unfortunately, this plays a more important role in that decision. However, it's always an individualized approach.
We covered a lot of information so far. We'll continue our conversation right after the break. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about breast cancer awareness and what you need to know about the latest diagnosis, treatment, and prevention care with Dr. Ann Friedrich from Bay State Surgical Oncology and Breast Specialists. And we want to start off now with the diagnosis of breast cancer. How is it diagnosed?
So most breast cancers are diagnosed using screening mammography. It's a very good tool. It's easily available. It's a quick study to do. And it's very sensitive, and it can detect even the tiniest changes in the breast tissue, especially the ones that we call calcifications. It's the best tool to pick those up, and those can often be cancerous. Not all the time, but we do see a lot of patients that go through screening. A smaller percentage will self-detect or have someone else notice a change in their breast, such as an asymmetry, a skin change, or a palpable mass, and they will present with symptoms. Most often, this is the way that we establish a relationship with our new patients. Sometimes additional imaging has to be done once they were there, but usually the screening mammography is the first tool that points us to the patient with a cancer in their breast.
So once a patient is diagnosed with breast cancer, what are the next steps for determining the best course of treatment?
So the first meeting is usually with a surgical oncologist or a medical oncologist to talk about the pathology first and about the treatment options. And there are three main ways that breast cancer is treated: surgery, medical therapy, and radiation therapy. And all of those physicians are usually involved in the patient's care team.
Who is involved in the patient's care team?
So besides those three, there's also social workers. A lot of times there are nurse navigators. Sometimes we need additional physicians such as plastic surgeons. Genetic counselors can be involved. And occasionally we need the help of other specialists such as interventional radiology as well. So it can be quite a bit.
Right, there's a lot of moving parts, obviously a lot of people involved in the treatment process. How closely does that team work together?
Vary.
Okay.
We communicate a lot. Most institutions also have a weekly or bi-weekly meeting called a tumor board, or a conference setting where new and challenging cases can be reviewed and discussed, especially when there's something that is not straightforward or might need a more individualized approach or might need information from other specialties that might not be readily available for the person during the first communication to the patient.
There's also something called immunotherapy. How does that work, and are the success rates there for that treatment?
Yeah, immunotherapy has been available for a couple of years, and we've seen a few patients having really nice successes with that. Not everyone qualifies for it. You need to have a certain subtype of cancer. Essentially, what it does is it helps your body's immune system recognize the cancer cell as a cancer cell, because cancer cells, being sneaky, have found a way around that. And this medication kind of shuts off that alternative way to allow the immune system to fight the cancer cell again. It's a great adjunct to care, and it can be really, really helpful.
Obviously, with technology advancing, some more breakthroughs are happening too. Any recent breakthroughs with breast cancer as of recently?
So there is a new dye available called MagTrace that we've started using in certain patients in order to mark the lymph nodes for up to 30 days. Sometimes patients don't need immediate lymph node assessment during the time of surgery. It's dependent on the final pathology after. And last year or 2 years ago, we had to check those nodes and then in hindsight say, oh, we didn't actually need to do that. Now we have this technology available to mark the nodes for future sampling if we needed to do that. And this way we can save a lot of morbidity in breast cancer treatment. Kind of goes along with the trend of using the care that works for the patient and not over-treating people and causing a lot of complications on the way.
Treatment also includes a lot of wellness therapies as well, mental health awareness counseling, massages, yoga. Maybe talk about some of those therapies as well to help with this disease?
It's really important to do these adjunct therapies, and what works for one patient will not work for another. So this is again an area where it's very individualized. Some patients may benefit from acupuncture, some patients may benefit from a social work intervention. A lot of patients benefit from support groups. So it really isn't a one-fits-all, but incorporating at least one or two of these adjunct therapies is important for mental health and for the ability to go through this treatment, which can often be prolonged.
Right. Do you think it is important for somebody to talk with somebody, no matter who it is, family member, somebody outside, third party, to discuss what's going on with them?
Yeah, most patients find that really helpful. There are occasional people that are very private that do not want to discuss their diagnosis and disease, but oftentimes during the treatment, since it's prolonged and it can take a couple of months to sometimes even more than a year, patients often do need the support, and family is very important when it comes to that.
Once someone has completed treatment and is in remission, as I mentioned, what does the follow-up plan consist of? What does that look like?
So oftentimes it consists of having a clinical exam every 6 months to a year with yearly screening using mammography, sometimes ultrasound, sometimes additional MRIs might be needed depending on what the treatment looked like for the specific patient. And occasionally plastic surgery steps in and kind of fixes areas that need to be addressed.
So is breast cancer preventable, and what are some lifestyle factors that can be changed to hopefully reduce the risk?
It's not 100% preventable. It's a very common disease to occur, and like I said, the lifetime risk is up to 12% for the average woman. But there are certain things that one can do to make that risk a little bit lower. Breastfeeding is one of those. The other things are lifestyle modifications, such as diet and exercise. It's important to have a healthy, well-balanced diet. And we do recommend exercise for cancer prevention, but also for survivorship improvement and recurrence prevention. And then another one is the avoidance of alcohol and nicotine. You don't have to avoid alcohol completely. The current recommendation says 3 times a week or less. Nicotine we usually recommend to abstain from.
Do we, as professionals, you as professionals, get updated numbers on how alcohol, tobacco, drug use affect breast cancer?
So every couple of years there are updated studies that come out, and then sometimes the modifications vary based on those results, yes.
How much of a role, we talked about genetics a lot, how much of a role does family history play?
So even in the person who doesn't have a genetic mutation that we know of, we know that the risk goes up the more family members have developed breast cancer or other types of cancer as well. And the thinking is that there might be genetic mutations that we don't know about yet. So a general family history of breast cancer does increase your risk ever so slightly, and then if there's more than one person, the risk goes up accordingly.
And does it depend on which side of the family, maternal, paternal?
No,
Okay.
Paternal family history can put you just as much at risk as a maternal family history. And if it's both sides, the risk is even a little bit higher again.
What advice do you have for somebody who is newly diagnosed with cancer? You know, they see that pathology report. What would you tell them?
So usually my first advice is big breath. There's great treatments available for all kind of stages and for all types of breast cancer nowadays. It's important to find a treatment team that you are comfortable with. Sometimes that involves getting a second opinion or seeing someone else. Usually patients in this area of the country enjoy having a lot of different options, and they like to choose a treatment team that works for them, because you will be seeing your providers quite a bit. And it's important that you talk to physicians that you like to talk to, especially when you see them sometimes on a monthly basis.
It's obviously a shock to the system for everyone involved. How can somebody's partner help with their significant other who has been diagnosed with cancer?
I think it's very important to join them for appointments. Oftentimes the information can be so much and can be so overwhelming that having a second set of eyes and second set of ears is just really important for your own emotional support, but then also to remember later on when you think of, did we talk about this? Did we ask this? What did we want to do? And sometimes you might forget the questions that you had. So it's great to bring a family member for support with a little notebook.
Well, Anne, thank you very much. A lot of information, but of course, very important and crucial information. Well, the Rays of Hope Walk and Run toward the cure of breast cancer takes place later this month. We'll learn more about what this event does for breast cancer patients in our region when we come back. You're watching 22 News in Focus. Welcome back to 22 News in Focus. This week we're talking about breast cancer as part of Breast Cancer Awareness Month. Each year thousands of events are held across the country to bring awareness of breast cancer and to raise money for medical research, education, and programs for patients. One of those events in our region is the Rays of Hope Walk and Run toward the cure of breast cancer, which has raised over $17 million since its beginning in 1994. Joining me now to talk about this event is Kathy Tobin, Director of Annual Giving and Events for the Bay State Health Foundation. Kathy, thank you very much for being on our program.
Thanks for having me. It's
$17 million, first of all, that's a lot of money.
It is a big accomplishment, and we hoped that in 31 years we would have a cure by now, but what we do know is we have made a tremendous impact on how we care for and treat breast cancer survivors. So you have an event coming up later this month. Talk about the Rays of Hope and how it was founded. So back in 1993, a nurse at Bay State Health, Lucy Giugio Cavallo, was 38 years old and in the midst of her own breast cancer treatment. She felt we could do better for women, and I was a health reporter at the time, and she said, I had a dream about you and you're going to help me. And here I am 31 years later, still working on the Rays of Hope event. But a lot has happened since then. We documented her journey, which was sort of setting the table for the walk and run, which was Lucy's vision to raise that awareness and, importantly, the money. 17 million sounds like a lot of money, but there's a lot of need. All of the dollars raised with Rays of Hope stay local, and that is the big difference with this event. So we are having an impact on local women and men, providing services and, importantly, research that really goes a long way in helping care for this disease. How did Bay State Health Foundation become involved? So actually, Rays of Hope preceded our foundation, which didn't come till later. And so Rays of Hope was already raising money and supporting the work at Bay State Health and throughout the community. And so when Bay State Health Foundation was formed, we are the fundraising arm for everything Bay State Health. And of course, now we work very closely together because we supply needed equipment. Sometimes it's programmatic support, it's research money, all of the things that help these programs really advance that mag trace that Dr. Friedrich was talking about earlier. We helped fund that recently, and this year, on our 30th anniversary, we're able to establish the Rays of Hope Endowment, which will ensure that in perpetuity, even if someday we can't have a walk or run, we still have money there to support people who need it. If you can talk about the Rays of Hope Center for Breast Cancer Research, how does that help local patients? That was a tremendous commitment. When that was founded in 2011, Rays of Hope put $1.5 million in to start that program. It's a collaboration between Bay State Health, UMass Chan Medical School, Amherst, and also the Pioneer Valley Life Sciences Group. All of these are scientists dedicated to helping find answers about breast cancer and improve the quality of life for survivors. And so that money was seed money, and we continue to support that annually. And that has looked into interesting questions. Why do certain people get breast cancer? Why are certain therapies effective for some and not others? Are there local environmental causes that may be important? We established a breast tissue registry, which has been crucial for scientists to be able to have samples of breast tissue for women in this locale, and that has been made available nationally to others who need it. So we've made a lot of gains. You think of Western Massachusetts as a small community, but we are powerful and mighty, and we're very dedicated to this. And a large amount of money obviously raised throughout the years as well, and you said it stays local, right? 100% stays local. Dr. Grace McCurry Judson had the vision of establishing the Breast Health Center around the same time Lucy was having her dream of this walk. And so they have traveled parallel courses, and we really have been able to change the way we treat breast cancer in this region and what we can offer. What are some additional programs Rays of Hope funds? Well, we're really excited that we started as a grassroots community event, and we have stayed true to that. In addition to the research and the programmatic support that we can provide, we also partner with other organizations in the community because we know we can't do it all. Right. And you talked about those alternative therapies. So groups, we have a grant process each year, and groups like the Cancer House of Hope and Margaret Toomey and her wonderful crew can supply some of those resources that we don't have the ability to provide. We partner with the local YMCA's on the Live Strong program, which helps survivors regain their strength, their confidence, and their mobility after surgery and breast cancer treatment. And we also do some fun therapeutic things like the dragon boats, both in Northampton and here locally in Springfield. And those teams have had some great experiences with breast cancer survivors, both physically and emotionally bonding through that experience.
And you did mention Margaret. We'll be speaking with her next segment. Are there treatments and programs free, discounted? How does that work?
So we don't subsidize individual patient treatments, but what we do is support systematic improvements that help those patients. But what we do and are able to do is if there's someone who needs, for example, a breast prosthetic and can't afford that and qualifies for financial aid, we do supplement that, and we can make referrals and make connections. So we have the Rays of Hope hotline, and we are there to answer questions, to be a resource, to be a big pink hug, we like to say, to anyone who needs us, and we make sure that people get connected where there's need.
Important question. How do people apply for the programs and the services that are offered?
Again, we have that helpline.
Okay.
We have our website, which provides a lot of information, baystatehealth.org/Rays of Hope. And we also have a grant process that we put out each year.
So speaking on the event, again, coming up this month, later this month, how many people on average participate, and what do you expect this year?
So the very first year, there were 500 people, mostly Lucy Giuggio's immediate family and friends, and we were thrilled to have 500 people. We didn't know if we would have that many come out. We got to over 20,000 in some of our biggest years, and then of course the COVID pandemic, really made us think about how we could do this differently, because as we like to say, hope was never canceled. Even during the COVID years, we were creative, we did drive-thrus, we had the event in alternative ways, and we have been building back from that. So last year we had about 10,000 people walking and running with us. We also had others walking virtually and raising money. So this year we're hoping to do a little better than that. We want you to all come back and participate. And it's important because there's nothing like the feel of being at that event and seeing that sea of pink, but the emotion of it. People check in and say, I'm here another year, I'm newly diagnosed and I need your help. Whatever it is, there's a sense of support, and I guess hope is the right word, that you can't get anywhere else.
Right, I mean also, thousands of people come out to this event. It's a good time to mingle with other people who are dealing with this same situation.
Absolutely. I have relationships with women. I don't always remember all the names, but I never forget a face. And, sometimes I only see them once a year at that event. But, I remember their stories, and we tell their stories. And we also remember those we've lost, because it's not a perfect science yet. And we have tribute flags and memorials, and we try to be really sensitive. But it's not a sad event. It is overall a very joyous celebration of life and of what is possible. So lots of resources and lots of reasons to come. And
we do have that information right now on your screen for the Rays of Hope Walk and Run Toward the Cure of Breast Cancer, happening Sunday, October 27th. I was thinking, honestly, I think it's a good time of year to have an event like this. The weather usually cooperates. It's cool enough, right? Knock on wood, but usually cool enough for a walk and a run, not too hot, not too cold, kind of a perfect weather condition.
Well, regardless of the conditions we're there, we have had all of the above. The very first year, I remember it being a monsoon the night before, and we had tied pink satin ribbons in our naivete around the course, and we had to go replace them all because they sort of melted in the rain. But we're prepared for anything, and we'll be there, sunshine, cold. The spirit carries you through.
We'll talk to meteorologist Brian Lapis.
Please.
Make sure that the weather is fine for Sunday, October 27th. Kathy, thank you as always.
Thank you so much.
Great information. Support during any illness is essential for recovery. After the break, we'll learn about the Cancer House of Hope, a program that provides various services to patients and caregivers. You're watching 22 News in Focus. Back now with 22 News in Focus and our discussion on breast cancer awareness. A cancer diagnosis is life-changing. Coping with the emotional, physical, and spiritual challenges of an illness, as well as dealing with daily life, can create incredible stress for the patient and their family, friends, and caregivers. The Center for Human Development has a program dedicated to cancer support services, the Cancer House of Hope. Here to discuss the programs and services offered in Cancer House of Hope Program Director Margaret Toomey. Margaret, thank you for being on our program today.
Thanks for having us.
So let's start with the basics here. What is, as mentioned, the Cancer House of Hope, and why was it created?
The CHD Cancer House of Hope is a regular home located in a residential area. It was created as a destination for people with a cancer diagnosis to have a place to come, to relax, find some therapies, and help them through on their journey.
How are you funded?
There's a variety of ways that we're funded. Our community partner, as Kathy just mentioned, the Rays of Hope is a great community partner to the Cancer House of Hope. Each year they grant us X amount of dollars, and that goes to all the programs, stays in-house, and supplements all our programs that we offer.
About how many people use your services every year, and are they open to both men and women?
Our services are open to both men and women. Our numbers are high right now. We have about 300 new members, we call them members, coming in each year. And of that, monthly, we have about 200 visits. So of those 300, they might come back 2 or 3 times to use our services, so we count those as visits. So we're up to 200 visits per month for our services.
You said they're high right now, especially for this year, or in recent years you've seen high numbers?
During COVID, we were at a low. Obviously, we went virtual with many of our programs.
Okay.
And then when we opened back up as soon as we could, the numbers skyrocketed. And they're still at a high point right now.
So what does that mean for you guys coordinating how to help these patients?
A little tricky. We've added some staff. We've added more hours for our oncology massage. The house is now open from 9 in the morning till 8:30 at night. Okay. to bring our services to those people who are in need. And we do everything that we can, bringing in different programs to meet their needs.
Do you need a referral, or can a patient just apply for these programs?
No referral is needed. Many times we get the member coming over just after being diagnosed to our program. The doctor's office gives them a pamphlet that we have, a rack card, and they come and search us out and see what we have to offer. And it gives them a sense of relief. It takes them out of that fright stage, that we're there to help them. All our services, they can find what it best fits their needs.
Yeah, what are the initial emotions that you see for somebody walking in for the first time?
Scared, frightened. Lots of times they come in with a good support system with their families, which is a good start. Sometimes they come in by themselves, which that individual, we try and surround them with as many people as we can while they're there. But it's a flight or fright situation. But
obviously a very safe place for them.
Oh, extremely safe, very welcoming. We meet each individual where they're at. We don't push anything on them. Whatever service they want to use, they can use. I always say try something once. If it works for you, then come back and see us again. But the services are just tremendous for these people.
And you mentioned some of those services that you offer, including a massage. What other types of services can patients receive?
We have a variety of services that we offer. Our wig boutique, we have 75 wigs on display. It's by appointment only, but especially women, having hair is critical. Yeah. They want to come in, they want to look good. Many people today that are diagnosed with cancer are working, so it's crucial for them to look good, feel good about themselves. Our wig boutique is very busy. We have oncology massage, we have Reiki, we have bra fitting, prosthetics fittings. We have therapeutic horseback riding, yoga, relaxation, restorative yoga. We have some outdoor activities. We have We call them the healing gardens out back that they can just sit and read a book if they'd like. So we have a variety of programs to offer to just about anybody.
Is there any charge for these programs and services?
We stay committed to our mission of free access to all our programs, so there is no charge whatsoever to anyone.
And how do you make that possible?
It's made possible through the Rays of Hope grant, their donations. They've been very generous to the Cancer House of Hope. We have 3 major fundraisers a year. We just finished up with our golf tournament over at Twin Hills Country Club 2 weeks ago. We have the Luminaria coming up on the Town Common in West Springfield on December 9th. And we also participate in Bikes Fight Cancer. Along with that, we have a lot of community partnerships that have fundraisers throughout the year that help us out also. And we have grants. We have the Community West Side Arts Council grant that supports our arts, and we have various grants that will help us along the way.
Of course, it's not just a challenge for the patient who is diagnosed with cancer, but also their family, spouse, partner. Do you offer services and programs for them as well?
Yes, we do. Limited. Our oncology massage is always booked, at least 8 to 10 weeks out, so we take that off for the family. But all our other services are open to the families when they come in for their support.
And what about aftercare services? What do you provide?
Well, we offer the same service for aftercare.
Okay.
It doesn't matter. A lot of these people that are out of the care, it's sometimes a year afterwards, sometimes it's 8 weeks afterwards, they start to feel different, where they need some of our services. So we just don't say that's it. You know, you've gone through your treatments and now there's nothing left. They keep coming, and we keep offering our services.
I mean, some say it's a lifelong journey right after your diagnosis.
It is.
Yeah.
It is a lifelong journey. We have many people that come back and end up being volunteers for us. So they stay within the house, they help us out, and they give back.
So when people come to the Cancer House of Hope, what are they generally looking for? Do they have something in mind that they want to see, or is it kind of like, help me with anything?
There's a lot of different questions that they ask. And being the director there, I can answer some, and some I have to refer to a licensed counselor. But it is, I think, the first question, am I going to be all right? And when they come through the doors and they see other people in their same situation, they get that feeling of, yes, I think I'm going to be all right after they talk to those people. Another thing is, what do you have that's going to make me feel better? Is this normal? Do I feel this? Do I feel that? Is this normal? So through our providers, our different programs that we offer, they get to talk to the facilitators, and they get different answers that puts them at ease. And oftentimes we have to tell them, refer back to their physician.
And we do have contact information on your screen, the Cancer House of Hope, that phone number 413-733-1858, also a website as well, right?
Yes, chd.org.
Okay, anything else that you think is worth mentioning? Anybody who is out there who, maybe feels lost, any inspiration that you can give them?
Sure. I would say give us a call. We're there Monday through Friday, and either our volunteers will pick up the phone or I'll pick it up, and then we will get back to you and offer our programs, and come on over anytime to see us.
Tough challenge, tough road ahead, but obviously with services that you offer, a step in the right direction.
Yeah, it's a destination for many to come visit us.
Margaret, thank you.
Thank you.
When we come back, we'll hear the personal story of a breast cancer survivor. This is 22 News in Focus. You've been watching 22 News in Focus. We've been discussing breast cancer diagnosis, treatment, and support programs. A cancer diagnosis is life-changing. Joining me now is Becky Gonzalez, a breast cancer survivor. Some great news. You just told me, Becky, 2 years cancer-free.
Yes.
How does that feel?
Great.
Yeah.
Super great, yes.
So let's get into it a little bit. Backtrack. How was your cancer found?
So back in 2019, I actually found a lump, and I made my appointment with my doctor for my for my annual.
Okay.
So I went in and I told I have a lump. He said, let's do a mammogram.
Yep.
So we went in for a mammogram, didn't find anything. So in 2020, COVID hit, so everything kind of shut down. I didn't go back. 2021, I felt the lump got bigger.
Yep.
So I went back and I saw him. I said, the lump's still there. It's bigger. So he checked his paperwork. He said, yeah, let's do a mammogram again and ultrasound.
Okay.
So sure enough, I went in, did the mammogram. They didn't find anything again. And then we went in for the ultrasound. And then that's when the tech found a lump. So she called in the doctor. He said, you felt it's bigger. She found something. Let's do a biopsy. So we did the schedule for a biopsy.
So what was your initial response when you found out of your diagnosis?
So when I went in for my results, before I went in, before that, they had told me, because I had dense breast, it was probably nothing. So I went by myself for my results, and he told me, he was just going on about some stuff, and then I heard the word cancer, so I was kind of shocked, of course. And then I just said to myself, like, if this happened 20 years ago, I would have been really bad, but with technology and everything nowadays, I'm good. I know what I got to do, so I just want to stay positive and move forward.
Yeah, how did you tell your friends and family? Did you wait some time? Did you try to, absorb what you heard? How did that go down?
So my mom knew I was going in for my appointment, so she was actually waiting for me to call her. So when I came out, she was the first person I told, right then and there. And I told her. She said, what happened? I said, I have cancer. And she said, no. And I said, yes. And she said, no. And I said, yes. And I said, we'll be fine.
Yep.
So, and then I actually went back to work. I told my coworkers, a lot of them were, hit them hard, because I've worked at my company was there for 24 years. So a lot of them took it hard. And then I told my immediate family also, before it got out to like everybody else.
I mean, that word in general, cancer, is shocking to anybody, but when they hear it, that somebody that they care about and love has cancer, it hits deep.
Yes, it does.
Yeah. Did you take part in any of the Cancer House of Hope programs, and how did they help?
Yes, so after my lumpectomy, I actually went and I got a pamphlet from the hospital, and they said that this place could help you. So I called and I set an appointment. We went in to see the house. I took a tour, and then I immediately signed up for massages. I did Reiki. There's yoga. I actually did the horseback riding also. And I love the meetings. They have breast cancer meeting, just women meetings on Tuesdays. So that was a godsend, because we had a place where I could go and talk to people that were going through the same thing as me. Because you can only talk to your family about specific stuff, but then when I would go there, we all knew what we were going through, so it was just like, oh, okay, we're good. So that was great for me.
You said that you had a lumpectomy.
Yes.
What was the process like of deciding and determining what was best for you? Mastectomy, double mastectomy, lumpectomy. How did you go down your path?
So because cancer does not run in my family, I decided to just do the lumpectomy instead of mastectomy.
Right.
The only thing is when they went in, I did have it was aggressive, so it was in my lymph nodes.
Okay.
So because it went into my lymph nodes, it's traveling, I opted to do chemo and radiation, only because cancer hides.
Yep.
So just to be on the safe side, I wanted to cover everything.
Did they use, do you know, that blue dye that the doctor was telling us about earlier?
Yes, they did, yes.
Okay.
And
that
that's
they
how
were able to, yeah.
Yeah, so it was 5 lymph nodes that they took out.
Okay.
2 of them were actually positive, 3 were not. So.
Did they do that at the time of your initial lumpectomy, or did you have to go back?
No, at the time of the lumpectomy.
Okay,
yeah.
so one surgery
Yeah.
in one. That's good.
Yeah.
What was the recovery process like?
From the surgery, it wasn't bad. The recovery for surgery was not bad at all.
Okay.
Now, getting into treatment that's the long process. That's the long haul.
Right, because you had radiation and chemo.
Yeah.
So talk about that journey and that process.
So we started chemo first. Chemo actually went from like January into May. It was once a week. I was on some heavy stuff because I had aggressive, it was traveling. But, you know, I stayed positive through the whole thing. And you got to push yourself because the drugs will knock you down.
Yeah.
They will knock you down. So I just stayed positive and I did what I had to do to keep myself going and moving.
How long did you have chemo for?
Chemo was, and it ended up being, 5 months.
Okay.
Yeah.
Okay. What has your experience taught you after, obviously, again, 2 years cancer-free? Looking back, what did you learn from that experience?
Basically, when you have a negative situation, stay positive in it. I've learned a lot in that aspect of just staying positive during everything, so it keeps you going. If you get negative and you stay in that negative state, you're not gonna move, you're not gonna progress.
Yeah.
So I just kept pushing, kept moving. I actually built a business out of this whole thing.
Okay.
So I actually was juicing while I was going through my treatments.
Okay.
And in doing that, I started like passing it along to other people, and they were just like, you know, you should really push this along. So I actually just opened up a juicery shop.
That's awesome.
6 months now.
Okay.
Yeah.
That's great.
So.
For somebody who just recently got a cancer diagnosis, what advice do you have for them? Obviously, you know the feelings that they are feeling right now. What would you tell them as they begin their journey?
I would tell them not to, you know, you're going to get a diagnosis, just take it, but don't, you know, cancer is a hard word to hear. Don't hide. Technology is so good nowadays that you can just, you can get through it, basically. It's a hard word, but stay positive and you can get through anything, really.
Well, again, 2 years cancer-free,
Thank you,
big
yeah.
accomplishment. A lot of hard work, I'm sure, leading up to this point, but that's great news.
Thank you.
So thank you very much, Becky.
Thank you.
Appreciate it.
Yeah.
All right, we'll have some final words after our short break. You're watching 22 News in Focus. You've been watching 22 News in Focus. We've been discussing breast cancer, the diagnosis, treatment, and aftercare available in our region. We want to thank our guests for being on the program and sharing this life-saving information. And thank you to our viewers for watching. If you missed any of this program, you can find it on our website at wwlp.com and the 22 News app. From all of us here at 22 News, enjoy your Sunday.